Hi everyone, welcome to the NIHR Insights Engagement Programme for the West Midlands. The webinar today is called Research World Research Careers, and the aims are to understand research careers, networking and engagement. So I'll now hand over to our presenters to introduce themselves. Thank you.
Thanks. Good afternoon, everyone. Thank you for joining us. Great to be here. My name's Nick Aldridge. I'm the Head of Research Delivery and Impact at University Hospitals Coventry and Warwickshire. I'll pass along to Alison.
Hi everyone, I'm Alison Cook and I'm the Associate Chief Nurse for Research and Education at University Hospitals of North Midlands. Saul, would you like to introduce yourself as well?
Yeah, absolutely. Hello everyone, my name's Saul. I'm combining roles as a staff nurse at University Hospitals of North Midlands in cardiology, and I'm also a PhD student at the University of Leicester.
Brilliant, thank you all. Well, thank you very much for having us here today and for joining us for this Insight programme. I've jumped straight in and I think I've jumped over. Alicia, did you want to mention the Insight programme before I go straight into our slideshow?
No, that's fine. I've introduced that. That's absolutely fine.
Okay, lovely. Thank you. So this webinar is part of the Insight Engagement Programme from across the West Midlands. And today's session, we've been asked to talk about real-world research careers. And we're hoping it sort of gives some interest and insight how to step into research, the different ways that you can be involved in research and the different career opportunities that offers. And that there isn't one linear pathway necessarily to be research active or even to step in to research. If I could have the next slide, please. Thank you. So we've done a quick round of introductions and you know who we all are. And I know we're all happy should any of you want to reach out to us after today's webinar for more information or for a chat, or if we are your local link, please do search us and we're happy for our information to be shared so you to have a conversation with us afterwards. So like I say, today is real world research careers. And if we have the next slide, we will get going. Excellent. So what we want to cover today is almost a current state, really. Where are we now? National strategies and papers, and what does the landscape look like? A brief overview of research career pathways, and then I'm going to talk you through my career through research delivery and what that does look like. Professor Alison Cook kindly joined us today. He's going to go through research leadership, and so I was introduced himself, and he's going to discuss how he's embarked on a clinical academic career. And then we'll wrap it up with where to go for help, support, and any questions we can hopefully answer at the end, or feel free to put them in the chat as we go through, but we'll try and answer them at the end so we can go through all the presentations first. Okay. Next slide, please. Brilliant. So to set the scene, really, this is where we are now in quite a unique and quite a special place, really, for sort of research activity. So you can see here there's 3 strategies listed, and we'll share the slides after so you can look at these in a bit more detail afterwards in your own time. So say 3 strategies, a 10-year health plan, Fit for the Future NHS health plan, and the OSCE report 2025. So a lot of information in those. It sort of sets the scene for where we want to go as NHS and what that looks like for us as MAPs, nurses, midwife, allied health professionals, and then the public at large and the impact that can have. So some of the common themes that were called out across these is that there's a move to research being everybody's business. Okay, so shifting from research being done only by academics to embedding research in clinical roles. Those that are closest to the bedside and closest to the areas making those changes. The move, and again, for some of this, probably not so much of a shock, but multidisciplinary research. So an approach and a collaboration between nurses, midwives and AHPs, driving research agendas, driving research questions, and actually being research active in the clinical setting. Again, won't be a shock to most of us, but a big drive on how we utilize digital and AI, how we look at these big data sets to either inform changes or actually for us to use as a tool to answer questions that we've got and understand that in more detail, take that evidence into practice. And evidence-based care, shifting from sick care to prevention, using high quality data to inform research for the future and improvements in quality of life and outcomes. And then looking at how within all of this we address underrepresented careers for underrepresented groups, and there's a drive at present particularly for midwives and specific nursing specialities. Okay, and this is really where the Insights programme sort of bring it in, sort of fits in. You can see the direction of travel It's getting the professional curiosity, getting research ready. And this is where this insight program, and hopefully for you that are on the call today, you've got an interest, you're curious already, you've landed with us today to sort of understand a bit more. And that's sort of where we're going as an NHS. You can see here, there's a big drive from the NHS, the NIHR, to get us research ready, whatever that looks like, and get our NMAP researchers for the future. And hopefully some of you with us today that will become that. So if I can have the next slide, please. Thank you. So we touched upon research career pathways. And again, from a lot of the work's going on, there's sort of crossover in what these strategies and reports are trying to achieve. But research is a national priority. We're on the radar now. We're very much, a area of go-to of interest and to make change. And for that, we've got to be faster in delivering research. We've got something 150-day target to set up to make sure we're setting up research quicker, increase research capacity for MMAPs like yourselves that are here today. We've touched upon that. And actually, our ambition is to increase clinical academics by 50% over the next 5 years. So big increase. It's a small number to start with, but in terms of percentage, a big drive there. I say there's a lot of crossover in how this is going to be done. So we talked about transforming research from the niche interest area to sort of a culture of standard practice for all of us to be curious. And they're being part of our professional identity and culture that we are research active. A seamless transition from the CNO strategy, looking at the framework for a seamless transition through different research career stages, from pre-reg, from students at all different professional levels. And again, this is where insights comes in to help navigate that. I look at overall a workforce increase of 1% of research activity, not just clinical academics, but 1% of the whole workforce being research active in one way or another by 2030. And then looking at the 10-year plan and how we make sure our frontline staff can generate evidence for new clinical pathways, and that being informed by research methodologies and research know-how. So you can see the current standing across national, local, regional picture is very much this drive to ensure we're research ready, research aware, research active, and our staff have the skills to ask the questions, to look into the areas that they know with the research methodology to change practice and improve outcomes for patients. And hopefully, again, like I say, that's one of the reasons you're here today, is because you're curious, you're looking at how to get involved into research. And I know the NIHR has research career pathways, and some of you may know this locally, some of you may not. And today, what we're going to go into is explain in a bit more detail how we've all navigated, three of us that are here today, how we've navigated our own research careers and how they've been different, but again, lots of opportunities, and hopefully some of this will resonate. Okay, so I can have the next slide, please. Brilliant. Okay. So this is a spotlight on research delivery. So I've worked in research delivery for 20-something years now, and that is delivering portfolios of research studies, some academic, some commercial, some of the NIHR portfolio adopters, taking sort of big multi-centered studies and delivering them across different sites, recruiting patients and carrying out the activities and feeding that back is how I first came in. So that's what research delivery is. But I'm going to go back in time. If I can have the next slide, please. And this is where I show my age a little bit, because this hospital no longer exists. It's knocked down and is actually the car park. But I qualified in this hospital many years ago and worked on C2 East and West general surgery and transplantation as a staff nurse. And I was over the moon, really excited. It's an area I worked in as a student, and I thought it was fantastic. And I was really over the moon to get a job there in that hospital, the hospital I trained at, with staff that I liked and a patient group that I really loved. So that's where I came into. Okay, next slide, please. And I didn't really know a huge amount of research in the clinical setting. I've done a research methodology as part of the training, as sort of a one-off module, and that was it really. And I didn't really quite know what clinical research looked like. And my first exposure to research in the clinical setting was with these two gentlemen here. The top gentleman being Professor Daniel Zender, and underneath Rob Higgins. And I'd like to say my first lean into research was groundbreaking, but the first part that I did was just press a button on a laptop after hours, helping Daniel while he was doing some arterial stiffness scans. And it was sort of very precise work. And if you moved, the reading went off. So I literally spent 2 hours pressing a button. One thing I did learn, apart from pressing buttons being very important, is if a professor says if you got 10 minutes after work, it means if you got 3 hours to sit very still and just keep, but that's fine. It was really fascinating work. And then the other gentleman, Professor Rob Higgins, did some groundbreaking work in sort of kidney transplantation, which is the area I worked in. and rejection. And he was trialing some different medications for a commercial sponsor, looking at reducing rejection rate and tolerability with different patient groups. And for this, again, handing out medication as part of my drug round and recording it as part of the study. So that was really my first glimpse into research and didn't really think too much of it. Next slide, please. Then we move over into the brave new world. So the old hospital, like I said, gets knocked down and we build a car park on it, and we move into university hospitals, a big, swanky, fancy hospital. We're all very excited. And part of the move is some of the areas to start taking on different specialities. And we inherited plastic surgery. Okay. And then one of the docs said, Nick, you've done a little bit of research before. And as you've seen on the last slide, my research was restricted to a button and handing out medication. But I said, gleefully and with the innocence of youth, yes, I like research a lot. I'm very interested in doing some more. And he said, brilliant, we're going to try some leeches, looking at using leeches to improve the uptake of skin grafts. Because some of them, when you pop them on the head, skin graft, pop them on the head is the technical term. Vascular doesn't take very well. They don't take very well because it's very difficult to get blood there. You put leeches on, leeches draw the blood through, the graft takes, is pretty much what that was. So fascinating work, spent 2 years working with leeches. There was only 3 of us that would work with them. I'll let you leave it to your own devices to decide why people didn't want to work with leeches, but I thought they were great colleagues. They didn't answer back and they were always at work on time and were happy to stay late. Okay, next slide, please. So then I've done this bit of research and I say I'm helping out. It's not my research. And I see a research nurse job come up and I'm very interested. And there's that gentleman that I met many years ago pressing the button. It was a job working for him on a study, looking at similar work to what he'd done. Then that's Dr. Kate McCarthy, a nurse who was a renal nurse that I knew. I said, would you be interested in this? I went to the interview and they said, well, tell us about your latest research that you've worked on. I told the leech story that I've just told you. And Daniel actually grew up in Peru, so we thought it was fascinating. So working with leeches, with Daniel and Kate with renal, it all came together. My background in renal transplantation, random work with leeches, it all came together and I was appointed into the job. But I did say to myself, this is for 12 months, that's me, then I'm going back to being on the ward. So first thing I do is learn these new skills, these new opportunities. And those that work I was helping Professor Sender with Daniel, I went away to Oxford University and learned how to do pulse oximetry, looking at arterial stiffness. I then had to learn lab skills on how to dissect kidneys, how to strip out arteries once the kidneys have been removed from polycystic kidney diseases. And this led us then to do some big commercial work looking at autosomal dominant polycystic kidney disease and the first medication to slow down the disease. And that study ran for 8 years, then came over into standard practice and then clinics in standard practice and the only treatment available. So jumping around a bit, but that was sort of my first intake into research and got into 12 months. I was really enjoying it and thought, actually, okay, what else is out there? And then Kate McCarthy mentioned to me, she said, what, if you looked at the clinical academic internship program at Birmingham, let's do some of your own research, let's build on this. Let's have the next slide, please. So did the clinical academic internship and found that I really enjoyed doing research and started looking into my own areas of interest. And one area I had was understanding why people took part in research, what were the motivations. So I set up my own questionnaire. So very light touch, but building my research skills, understanding how methodology is put together, how protocols put together from all my time working in clinical delivery. And then went on and did my own research there and started to build a bit of a body of work. And again, I'm still only thinking I'm staying 12 months, but I'm about 3-4 years in now and deciding actually let's keep going. Next opportunity came up was a senior research nurse job in the same hospital. And that's Kerry Jones there. She's the manager of R&D. I applied for the job to manage the renal team. And as fate had it, they said, actually, Nick, we don't want you to manage that. How do you fancy working with the BIU and the research midwives? I said, but I'm a renal research nurse. They said, no, that's fine. We want you to take your research knowledge and help and develop this team here. So again, one of the most committed teams and a very, very emotive area to work in. It's fantastic. I love working with them. It was brilliant. We set up Tom International Centre for Miscarriage Research. And you can see at the bottom there, the team. And then there's a picture of me in the corner with those that know me, no grey hair in that one. So it's a very long time ago. But that was sort of building on my research knowledge and taking it to a different speciality and the team what I had to offer there. And that combination with those with the clinical skills and my research background came together, we were very successful, and we were able to do some great work for the women that we were looking after and the partners as well. Next slide, please. So at this point, reality kicks in. I do love research. Research is for me. And I've delivered academic research. I've worked on large-scale interventional commercial trials. I've completed internships. I've done my own work, and I've got a portfolio of specialities. And I thought, okay, research is for me. And I did a bit of thinking. Actually, research is now my speciality, and research delivery is my area of expertise. And all of that came together. That was sort of a light bulb moment, because I'm trying to figure out where you sit within the workforce and what that looks like. And research is a little bit out on its own sometimes, and that's why you've got to bring it back in. And thought, actually, no, research delivery is my area of expertise, and I'm very proud of that. Next slide, please. So we carry on. What's next? And then a lead nurse for research and development comes up. And I do a bit of academic study, so I go off and do some more academia's masters, work like that in publications. But time flies when you're having fun. And before you know it, you've included a huge team of brilliant staff, which is fantastic. And I've gone on and done the 70 NIHR Senior Research Programme. It was advertised, and I worked with some fantastic, really awe-inspiring people. I'm very lucky that some of those people I still work with today. And I was bringing these nurses and midwives together to be research leaders in all different ways. Not so many from delivery, a lot from academia, but lots of people coming together. And from this, I'm starting to build and share my knowledge with different teams and give opportunities back, set up human metabolic research units, do different work and celebrate what it is we do as a research team in the hospital. Next slide, please. But then for everyone, we all had a huge change of plans. COVID hit, didn't it? But at the same time, research came to the forefront, and I've never been so popular within a workplace. Anyone that worked in research at the time were very popular. Everyone seemed to think we knew things that no one else knew, which wasn't true. But a huge amount of work came through at pace. And what COVID did do was demonstrate the impact of research delivery, the impact of nursing, midwife, allied health professionals all coming together to run research with medics in hospital settings quickly, efficiently, and get results. And the top picture there is the nurse giving a thumbs up was Julie, and that's her actually recruiting to one of our COVID studies on the ward while she was followed by the Guardian newspaper. And then we did the recovery study, which a lot of people on this call may be aware of, COP. And one of our big studies that we ran here was Valneva, a vaccine study. And that bottom picture with all the squares and of all the different team members literally brought 150 staff from R&D together from all different backgrounds to run one-stop vaccine clinics, and we'd run them straight through the weekend, Saturday, Sunday, for people that could get to them outside of work. And all of that skills and knowledge came together to be able to deliver that. So that was sort of, for me and the team, almost a level of justification we didn't know was needed to demonstrate what it is that we can do as a department. Next slide, please. Okay, so I thought I was finished at this point. I thought, brilliant, I'm lead nurse. It's all going extremely well. We've done COVID, we've cured that, that's done, we've sorted that, we're brilliant, we've got a team, we know what we're doing. And then a new dream job came up that I didn't know existed. And this was what I'm doing today. So this head of research delivery and impact. And I was very fortunate again to be able to work with Tracy Bridgestock, my CNO, who really values research and has been brilliant support, and Jane Code, you can see in there, and Agnieszka, who have been really helpful, really supportive, and Jane especially in pointing out areas to sort of develop skills, knowledge, and what we can do. And for me, part of this role was bringing my knowledge together and seeing what we could give back. So we had a research council embedded in this organisation, which champion and take research ideas from our workforce and see how that can change and embed not only for the workforce, but for the patients that we look after. Created the iCare programme, which is a master's module, and research placement programme. Those two, the picture in the middle, you can see there some of our students presenting their posters. Then did things like the Define study working with NHS England, which we created CNO Excellence Fellows. And then the DAISY Foundation also been able to pull together CNO and DAISY Fellowship, where a member of staff was able to come along and take some research questions, develop, build and answer some questions there. So sort of giving back and a wrap around to the sort of internship opportunities I had. Okay. So, and then it accumulates really at the bottom there. You can see Red for Research Day. We lit up the whole hospital, a real celebration at the hospital is research active with all these different members of staff from different backgrounds, building the future, making changes for patients and making changes for workforce and different career opportunities that didn't necessarily exist. Next slide, please. So that's a very quick whistle-stop tour of sort of what my touch points were for research, and it's been hard work, but a lot of it's been fortuitous, and a lot of it has been through helping with people supporting me. So in conclusion, the key points I'd like you to take and think about is take the opportunities as they come. You never know when they're coming. They're never a good time. It's never the right time. But take them as they come and explore. Network and collaborate. A lot of people want to help, a lot of support out there. Reach out. People will happily help you. Seeking strong mentors. You won't know when they're there, but they are. You'll know the people in your own departments who will help and want to drive you forward. And I'm pulling together lots of people around you that can help do that. It is worth its weight in gold. Put your ideas forward. They're always valid. You've got a unique perspective that no one else will have seen, and sometimes you've seen something no one else has. I'd say ask for support. Give back, support others. I'm very keen that we all have that feedback loop. There's always, everyone has got to where they are through being supported. Please ensure we support people back, and it's how we continue to grow. And with that, just continue to be curious. You've got professional curiosity, you've got curiosity. You're here today because you're curious, and hopefully you'll understand a little bit more about different options, different ways of working, or even just a bit more about the Insight program or someone to come and speak to. So I'm going to stop talking there. Thank you for listening to me. And I will pass over to Alison, who's going to talk us through her journey.
Thank you, Nick. Next slide, please, Alicia. So, and the next one, if that's all right. Okay, so what I hope is that when you listen to Nick's story, to my story, and to Saul's story as well, is the amount of bits of overlap where we've crossed similar paths, because research isn't really a set pathway. That certainly the top levels, the strategic levels, national levels are attempting to get those pathways in place. But really, all of us in research at the present time have sort of had to navigate our own pathways, or we've just grabbed opportunities as they've fallen into our pathways. But it's really funny. It's a really small world, and we do cross paths a lot with our counterparts, even though we might be working in different areas. So I've given you here a full lifetime of my working career right from the start, when I left school, actually, which gives away my age, which is a bit unfortunate. But I left school intending to go to university and become a teacher. I think I've probably come full circle because I do teach now. But I didn't get the A-levels I needed. I failed my A-levels, and my dad said, you need to get a job in finance. There's always jobs in finance, so off you go and get a job in a bank. So I did manage to get a job in an insurance company. And worked there for quite a substantial amount of time, really bored to tears. But it was after I'd had my second child, I realised that actually I'd missed my vocation in life, and what I should be in is a caring profession, because I absolutely was so in awe of the care that I'd been given by the midwife I had with my second pregnancy, and I realised I wanted to give back. The problem was I hadn't got the A-levels required to get into university to do midwifery, so I went and studied with the Open University, got a diploma in French, which is nothing to do with midwifery, but I knew I was good at French, I was good at languages, and actually I just needed to show that I could study at university level, and that gave me the entry criteria I needed to get onto a midwifery degree programme. When I was at university doing my midwifery, I was one of two in our cohort that actually enjoyed the research modules. So I suppose it was no surprise actually that when that opportunity arose, I did end up going that way. 3 years after I'd qualified, I tend to work in threes. Every 3 years I need to challenge myself with something, if not a shorter time. But after 3 years I wanted a challenge, and a research midwife post came up. And I deliver lots of sessions that are research nurse versus nurse researcher, and trying to explain to people what the difference is between the two. But a research midwife role tends to be in delivery, research delivery, which is, as Nick has said, is his area of specialism in research. So I was expecting to go and get a role where I was delivering research on behalf of other lead researchers. When I got into post, actually my line manager was a professor of midwifery, and instead of asking me to recruit and consent and collect data on behalf of participants in her studies, she actually gave me a research question she needed answering, and asked me to do the research. So very spoilt was I to be given this massive opportunity to actually look at that question from the start, and go through ethics, do a systematic review, be actually the chief investigator for the study and collect the data, analyse the data and publish the data afterwards. I never looked back from that, and I'm ever grateful to that professor of midwifery for giving me that opportunity. The things that I actually learnt and achieved from that one role and that opportunity that I was given set the pathway for my whole research career, and I'll never forget that. The part-time research midwife role I took was only an 18-month fixed-term contract. That's often how research roles are. They tend to be fixed-term because they're often governed by how much funding has been awarded for the study that you've managed to achieve funding for. But luckily, I did that study within the 18 months and then picked up a master's in research. And that was the first funded Masters in Research that the NIHR offered. I was in that first cohort in 2009, and was able to get all the foundation knowledge to be able to go on and lead research with a bit more confidence going forwards. The other thing that the professor encouraged me to do was to publish. She said to me when I got the job, have you got anything that you could publish now, just so you have some publications under your belt in case you want to go for any funding? And I said, well, I've got this assignment that the feedback said I ought to consider publishing, but I just thought it was just sort of nice to get that sort of comment in my feedback. And she said, right, let's have a look at that. And that was my first publication. So as students and as newly qualified, if you've got those assignments where somebody said this was great and you ought to consider thinking about publishing this, or if you got a high mark, you should definitely consider publishing it, because seeing yourself in print, your name as the author of a paper, there's nothing like it. It's really satisfying. So I published, I got my master's in research, then I took up a new role, went back into research delivery. I took up a role with the Regional Research Delivery Network as an industry manager, so that I was pushing for recruitment to time and target on lots of commercially funded clinical trials. So I did that for a while as well. So again, crossed back over into research delivery, and then I managed to get a PhD fellowship. So that meant that I came back into leading research again. Then I picked up a job as a teaching and research contractor to a university, and then I've moved into this current role. But none of the roles that I've had, and you can see I've had quite a lot of different roles on that pathway, were planned. But I did seek opportunities because I'm that type of person. I like a challenge, and often researchers are the why people. My mum will always say that when I was little, I used to drive her mad asking her why this, why that, why do we do that, why are we doing that, when are we going to do that, how are we going to do that? And so it's no surprise really that I'm in the role that I am. I did seek out these new opportunities and I grabbed them with both hands, because I've absolutely loved everything that I've been able to do in terms of research. If we just move on to the next slide, if that's all right, Lissy, I'm just going to hone in on just a couple of things on my, well, it's more than a couple, obviously, you can see there. From my roadmap, but just to let you know really that the question that I am most well known for is to do with neonatal skin care, and that was my doctoral research, my PhD. But that question actually cropped up when I was a student midwife out observing with a qualified midwife on a postnatal visit, and the mums were always concerned about babies having dry skin. A new mum wants their baby to look perfect. They want it to be like the babies that you see on all the adverts, and the skin is just so beautiful, and always used to ask about it. And all the midwives used to say, every single one used to say, oh, put a bit of olive oil on that, anything you've got in the cupboard, it's natural, so it's safe, and it'll moisturize the skin, and that you won't be able to see the dry skin, it will resolve very quickly. And I was already a mum of 4 kids by this point, and I thought I would have never, ever wanted my children to smell of cooking oil. I would have never wanted to go near them with cooking oil. What on earth? Where is this coming from, this advice? And it bothered me and bothered me and bothered me. But even when I qualified as a midwife, I used to say the same thing, because it's a lot of midwifery practice certainly is traditional. You know, you pass on through the generations of midwives, midwife to student, then student becomes the midwife and passes the information on to their student. But nobody really questions it very often. But when it came to do a doctorate, my professor of midwifery was actually doing some studies in neonatal skincare, but hadn't looked in any way in terms of oils. So when I said to her, I've got this question that has really bugged me right from the very start of my midwifery training on oil, she was really excited about that and wanted to support me to do that as my doctorate. So that was the start, a question that had arisen in my student times is actually where my research career has come from. So I told you a bit about the first publication, and that's there, that when will we change practice and stop directing stop directing pushing in labour, and that was my evidence-based practice assignment. So that was where I managed to publish, but then shortly after got my master's in research. And funnily enough, another thing that I'm really well known for is a search strategy framework called SPIDER. And I've actually been cited over 3,000 times for this particular search strategy framework, which is incredible for a health professional to be known for a methodology. But actually that all came through from that very first job again, where I did a metasynthesis, which is a systematic review of qualitative research, and realised that PICO, which we're all trained to use in university to do searches, actually isn't very well adjusted for qualitative research, and you don't really get the papers that you need to. And I wrote off to a prolific author, Andrew Booth, who'd done lots of work on PICO, and said, would you be interested in doing a paper on an idea I've had on a new search strategy? And he said yes, and that is the thing I'm most well known for. And in clinical librarian environments, I'm known as Spider Woman, which is just ridiculous, but a claim to fame, if you like. In terms of my doctoral research, that's actually changed practice. It's changed global clinical guidelines. We've changed practice in the UK, so olive oil is not particularly well recommended anymore. It still slips through from time to time, but it's not recommended. So it's that's something that my research career has helped to do. It's actually gone from a question that arose in practice to changing practice globally. And then you get known for what you've done. If you conduct quality research, then you are sort of forever sought out for any research in that area. So I've had a number of commission grants as well to do further work in that area, which has been brilliant. Next slide, please. So for my part, just to finish off, it's funny that Nick and I both did our slides separately, but both came up with the same key message in terms of being curious. In my role now, this tends to be the thing I tell everybody, because everybody's a bit wary of research and a bit fearful of it and think that it's somebody else's business and not ours. But actually, if you always ask questions of your clinical practice, why are we doing it this way? Is there a better way? And then what does the evidence say? Then actually you're research active, because you are wanting to find out what is the best clinical practice to provide for your patients. So my key message is also to be curious, just as Nick's was. And I think I've probably gone over by a minute or so, but I'll hand over now to Saul.
Yeah, hi everyone. Yeah, it's great to be here this afternoon. If we just move the slide on one more, please. Yeah, so as I mentioned before, my name's Saul, and I'm currently combining roles as a staff nurse at University Hospital of North Midlands with doing a PhD at the University of Leicester. And so this is my slide, and it really shows my sort of career so far. But still, it's very much a work in progress, and I'm still seeking out opportunities. I'm not sure where it's going to go, but I think it's going to combine clinical practice with research. So I started by putting research across the top, really, and my clinical career across the bottom. But these two for me have really been quite closely intertwined. I think they're very complementary, and personally I think that it really works best when we combine them in this way. The research really informs your clinical practice, and the clinical practice strengthens your research, making it more relevant. and it really gives you a better understanding, I think, of what the real challenges are. So my career in healthcare, it really began back in 2013 when I started my nurse training at Salford Royal. I graduated 3 years later, and after that I had some pretty different roles actually, first in intensive care and then moving to a very contrasting environment in prison nursing, before settling on a career in cardiology where I still work today, just one day on a Friday alongside my PhD. I've done a few different things in cardiology, working as a staff nurse in the cath labs. I was a nurse practitioner for a little while, but I'm also back working as a staff nurse currently again on the Friday. And I think this is really one of the great things about jobs in healthcare. You know, you can undertake quite diverse roles, find what you enjoy, and this combined experience really shapes you. You know, it's useful and it's widely seen as a good thing. So I think about research. My interest in research really started in my nurse training actually, when I realised just how much information there was and just how accessible it is and how it actually makes your job easier. I think in any new profession, it's normal to experience quite a lot of uncertainty, and it's definitely something that I struggled with, being uncertain. And you know, the way that you deal with that is often to ask people, you know, what do you do? And I suppose I was never quite comfortable just doing it. And I found looking at these research papers and guidelines gave me a bit more confidence that at least what I was doing was grounded in some kind of evidence. But if I think back now, perhaps I didn't have that much confidence to use that in my practice at that point in time. I always thought there was some kind of mystique, something surrounding research that presented that barrier. And I think it's something that a lot of people talk about, that theory practice gap. So yeah, I mean, I became more involved in research after starting in cardiology. And this was really in response to kind of a problem that I noticed from my practice. And the thing that this was one thing that really stood out to me is that patients I was seeing very regularly with a heart attack coming into the hospital were often smokers. And quite commonly, we'd actually see them coming back again with another heart attack, you know, which sadly for quite a few, they wouldn't survive. You know, and I often heard the doctors telling patients the importance of stopping smoking, and this was perhaps the main reason why they were back. But I couldn't really understand why nothing more was done really to help them stop smoking when the stakes were so high. You know, we had so much emphasis on getting them on the right tablets, on their aspirins and the statins, and putting stents in the coronary arteries. And the smoking cessation part was just obviously at the end sometimes just a flippant remark. You know, you need to go and see your GP, you need to get some stuff prescribed. But I think really, if we asked ourselves, we knew that they wouldn't, and there's lots of barriers, you know, with accessing your GP, getting appointments in the first place. And it really seemed to me that we had our priorities mixed up. So at this point in time, I was friends with one of the doctors. You know, he did some research, but mostly we spoke about fishing. We had a mutual interest in this. Well, he suggested to me, Saul, why don't you find out some more about this? You know, look at what evidence exists and write it up as a paper. I mean, at this time, you know, I thought this was not really something that I could do. I remember thinking, you know, what do I, a band 5 staff nurse, know about this, or what could I possibly add that doctors or, you know, the high flying academics don't know already? But I think this is a thing that, you know, was mentioned before, that, you know, we're all different in our professions and we all see things very differently. And I think if we, you know, ask questions of our own practice area, I'm certain that among the small group we have here today, there'd be more than a few answers to those questions that perhaps could improve practice or the lives of our colleagues. And as we've said, you know, research should really be everyone's business, and you know, you can engage with that at any point of your career, and perhaps you could argue the earlier the better, and you've got time to develop those skills and put them to use. And this is something that I've really learned. And on reflection of this, I suppose I've always really had questions, you know, whether this was early in my nurse training or early in the career, and perhaps, you know, you like me didn't always have the confidence to ask them. But what became apparent was these questions that you had, often they were important questions, and you know, they were come from a legitimate place. So I think the gap between now and then is that I have this little book, and any questions that come up, I write them down, you know, furiously, and I hope that at some point in time I can revisit them, you know, when I get time. And perhaps that's something that I would encourage everyone to do. So going back to the slide, you know, we finished this literature review, which actually took a long time, and I worked on this with some different authors, including some very senior academics at Keele University and some clinicians, doctors that I was working with. And I found myself entering into this little circle of people that it seemed very unlikely, shall we say, when I first started. But actually what I was really struck by was just how supportive that these people are, how accessible these people that I saw as so inaccessible actually turned out to be, and and how helpful they were to my research career. So we published this literature review as a paper that was my first ever published paper in 2021, which was a real sort of key point in my career. But from this paper, I suppose, really, I wasn't satisfied with the answers from the existing published literature that we got. And, I really wanted to find out more about this problem. And the work I'd done on this paper was really, I did it kind of after work, kind of late at night. I had sort of 2 young children at this point, as well as working a full-time job as a nurse. So perhaps working, late at night on research projects was not probably top of my list of things to do. But fortunately, around this time in our hospital at Stoke, I made an appointment to go and see the newly established SENRE team, and I'm sure there's equivalent teams in many of the trusts that you work in. And it was actually Alison, who I met. The team really helped me to sort through what options were available to me and if I wanted to pursue a career in research. And they helped me to put together an application for something called the PCAF Award, which I think is still around now. Funded by the National Institute of Health Research. And this kind of opportunity really sounded too good to be true to me. It was a funded master's, as well as, most importantly, this clinical time that was brought out to do it. I think for anyone who's tried to get course funding from your department in the past, it was really an amazing opportunity. And we spent some time putting this application together. And if I reflect on what the application looked like at the start, and it's basically just this research question that I wanted to understand and this academic career that I wanted to establish, to what it was like in the end, it was, moved on so much. And I think down to the expertise of the SENRE team in Stoke, but also my kind of burning desire to get to the bottom of this research question, I was successful with this application. And as part of that, I started a research master's at the University of Manchester, as well as also identifying some excellent clinical and academic mentors and support from the team that I had at Stoke. And going back to the slide, I finished this PCAF award and a research master's in 2024. And I really learned so much about the application of research methods to healthcare, and really my enthusiasm for research and clinical practice, it just grew and grew. And I think my confidence that I mentioned at the start about understanding research and about applying research to my clinical practice, one thing I noticed, it really gave me a lot more confidence in my clinical role. And, I found myself going from just being a bystander in the room and listening to this stuff and thinking about it, to actually stopping the doctors, explaining the importance of smoking cessation, explaining that was the reason that the patients were coming back, educating them on pharmacotherapies, on psychological support, as well as identifying which patients were likely to face additional barriers, in quitting smoking, and how we could perhaps support them better. But from here, I wasn't finished. I wanted to do more, as I think we all do. So I then started to think, what's next? So I wanted to do a PhD. And for anyone who's in that position, there's a number of different options available. There's some competitive streams through NIHR. There's other funded pathways like the Wellcome Trust. But I was quite keen to start as quickly as possible, really. And in the end, I found a funded PhD at the University of Leicester, which really aligned with my research interests. And I was able to navigate this kind of studentship stipend from the University of Leicester, as well as working clinically at the same time. And actually, financially, I was in a pretty good place, similar to where I was working as a nurse. And the focus of this PhD, the work still includes smoking, but this time it's around people presenting with the symptom of breathlessness. And it's about how stigma and the way we treat patients is responsible for pushing individuals who need help most further away. So on reflection, I think programs like Insight Today or the PCAF that I went on can be really amazing springboards to developing your research career and making you a better clinician, whether that's a nurse or a physio or a speech and language therapist. And I really would recommend it to anyone. And I think it's interesting what the others said really about the sort of key points. I really don't think I'm perhaps the brightest or the most academically able, and I certainly wasn't, when I began my nurse training. However, I think the thing that set me apart is having the interest or passion in that word curiosity again that's been used so much today. I think to improve patient care or to understand more. And I think what these opportunities provide is the research skills to enable you to take this further and to understand more. Yeah, and I guess that's it for me. Thank you all for listening. I think it's quite strange to talk about yourself for so long, but I hope perhaps that's useful to you in some way. thinking about your own careers. Thanks.
Brilliant. Thank you very much. That was great to hear your journey. And we'll come back with some reflection. I've been scribbling notes down as you've both been speaking, so I'll come back to that. So I'll go to the next slide, please. Brilliant. So you've heard sort of from three of us there around our very varying ventures through research, our career pathways, and what that looks like, and what it can be to navigate that. But for bringing it back to everyone that's on the call at the moment, where would you go now for help and support? We've established that you're curious and you've got an interest and you want to do something else, and you're sort of trying to find out where the next step is, and it can be quite daunting. So we mentioned there reaching out, really. We've talked about collaboration. So research and academic development team, have a conversation with them if they're either local or at your local university or through the NIHR. A good place to start is your R&D department. If you're unsure where to go, they'll point you in the right direction or put you in contact with the right people there. You've then got your or universities and education departments. Reach out, see what's available, see what's there. There's lots of different programs on offer. And again, look at what you've got locally. What principal investigators have you got that you know of? Who's doing some work in your area, or where would you like to? Just ask the question. And we talked about here, the three of us have published and have got pieces of work out there. If you read something and you're interested in it, reach out to the author. Most of the time, we're quite flattered that someone's even got in touch with you and read your piece of work. I haven't got a fancy nickname like Spider Woman, unfortunately, but if it's about research delivering some of the work I've done there, I quite often get cited. That's from my point on that. And so you can see now is groundbreaking the work that in terms of what's how you care and look at actually interventions for smoking cessation. Actually, can that decrease the second heart attack sort of situation? So you can see it there. So reach out to people. They want to speak to you, and you may have a very different take on it or how it could be applied in your area. And same with the chief investigators. They're really big studies. They're always interested to speak about their work. Okay. And like I said, and if you may be interested in becoming a principal investigator, we've got here, it's only one of many of the NIHR opportunities, but lots of opportunities on the NIHR website. Immerse yourself in it, have a look for what things are, the associate PI scheme. So develop your skills to become a principal investigator and working with other principal investigators there. So lots there for you, but from what we've said, stay curious, reach out to people, ask questions. People want to help, people want to get back to you. Okay. It's also that you mentioned something around how accessible it is at the moment. I'm not plugging the program, but we are at the same time, is a fantastic opportunity to be able to access and get funded to do a master's in research with a broad spectrum of universities to look at to develop your curiosity, your area. And again, be confident. You've got a lot to offer. You've got a unique perspective in your own speciality. You've seen the drive nationally to get research local in the clinical area for those staff that have got the query, got the questions, and pulling everything together to ask that. So they're the important questions. So you've got those questions. Here's one pathway for you to engage with, and you've heard from the three of us the different sort of ways that we've negotiated our careers and what we've got there. So I'm going to round up there and go on to the next slide, if you don't mind. And we've got 10 minutes or so left. Happy to ask for questions around. I'm happy to take questions on what I present and the other two are, or if you've got any more specific questions about the Insight programme or anything else. And if there's anything in the chat, I can't see it at the moment, but yeah, okay. Petra, go ahead.
Hi, it's Peter.
Sorry, Peter, sorry.
Don't worry, get it all the time. I was just going to ask, I'm an occupational therapist.
Okay.
And I've obviously got Insight funding, and I'm now doing a master's in clinical research.
Fantastic.
The trust I work in I have like a couple of issues in that OTs don't tend to be as prominent in research.
Okay.
So I've definitely been limited in people I have available to go to.
Yeah.
But I have looked at dozens of research nurse posts because I know it's the thing that some of them, although it says research nurse, you don't have to be a nurse by background. Trying to find those is very difficult because they usually require injections or other sort of nursing skills that AHPs can't do. Is there any advice or alternative routes you could think of that you advise?
Yeah, so I'll pick up with anyone else wants to come in there. So In terms of OTs, I'm happy for you to link up some of the OTs who've got active at our organisation, and that they may be able to help support and develop whatever it is you're looking at there. In terms of the more specific roles, you are right. You do see a lot of nursing midwife advertisement, depending on the research they're working on, don't necessarily have to be that unless they want you to hold an NMC pin. My advice to you would be confident in your ability and put forward what you offer, if that makes sense. So you've got a huge amount of research background, you've got OT. Is there almost a conversation for you developing, creating that role that doesn't exist at the moment? Because they don't know you're there, if that makes sense. They don't know that there is an ability to do something there. So that's one way to do it. But like we said, network, collaborate. Go and reach out to your local R&D department. Let them know who you are. Because then when they come up, we've got a bit of funding and we need an additional post here. Historically, they we go to what we know. And for a lot of the departments, it's necessary. So make them aware of you, and then maybe start building a case of what your role could look like as well. I don't think that's got anything. Alison, if you've got any different take on that.
Yeah, I'd agree with everything you've said, Nick, but I'd also say whenever any of those roles come out, there's always a contact person, and always ring and speak to them and see whether it's whether what you can offer would be something they might consider. Sometimes it's really difficult to recruit into these roles. So actually, they might be willing to think about, and they might not have thought about what you can offer as a role before, and might be willing to adjust the role to make it suitable for you. That what they want really is people who are passionate and are going to come in and work hard. So actually, anybody out of the rest of the team would be able to give the injections or whatever. So it's really important that you never refrain. You don't just read it and think, oh, that's not for me. Just give them a ring and just see whether there is a possibility that it could be flexible to allow you to apply for that role.
That's really good advice. Thank you.
Great, thank you. Apologies for getting your name wrong. Have you dropped me an email and I can put you in touch with some of our research active OTs locally, because I think they've got a bigger group to get you involved with as well.
Is your email in the slides?
If it's not, I will send it. I should be. I'll put it in the chat. I'm happy if anyone to have it before we go.
Thank you.
Well, thank you. Any other questions? Let me check in the chat while I'm here. I'll just put my email in while we're looking.
Go ahead, Saul.
I was just going to say, I think I agree that it's amazing just how helpful people are if you identify occupational therapists elsewhere in the country who are either combining clinical academic careers or involved in research delivery, and reach out to them via email. I guarantee you'll be surprised just how supportive they are, especially probably because they want to develop that culture and get more occupational therapists into research. If you're saying there's so few, then that's certainly something that needs to be addressed, isn't it? So if you can't find a job in research delivery, perhaps you've got your own research questions or things that need to be done in occupational therapy that you can develop and become, someone who's leading occupational therapy research. Sounds like something that needs to be done too.
No pressure.
Yeah, no pressure. If you could just change the whole service, that'd be brilliant for you. but they're great points. And again, we've mentioned the national drive about underrepresented groups and workforces. That is one of those groups. So it's not out of keeping with the direction of travel and the support that's available. And like I said, we've said, if you reach out to someone that's interested and you're obviously passionate and keen in what you do, it's great to work with people like that. So I doubt you'll get too much pushback. Good luck. I'll put my email in the chat. Anyone else? Oh, hello, Liz. That's a friendly face in the crowd. I didn't see you there. Yeah, go ahead.
Hi there. Thank you very much, Nick, and thank you to all of our speakers, including yourself. It's been genuinely fascinating. So what I wanted to ask is something that perhaps wouldn't otherwise come out, and that's about the connectivity after something like the Insights programme or, PCAFs, which has also been mentioned. And whilst I know you're not here to talk about all the programmes, as presenters, you've all talked about how you pulled together your career, and mine isn't dissimilar, really. but it's interesting to me about how I often get asked where next, after either after Insights or after Peak Off, and not just where next, but how next. So I wonder if any of the three speakers could offer how they knew what to do next, especially if they wanted to stay in the research delivery or academic zone, which is essentially another part of the same research zone. Thank you.
Thanks, Liz. Great question. Some of it's, for me, has been fortuitous in terms of right place, right time, or not even necessarily right time, but right place. For me, a lot of it's come through collaboration, saying yes to those opportunities and sort of putting yourself out there a little bit, and then the doors start to open. That you don't realize something exists until you step into it and you go, okay, that's what I want next. That's what I'm really interested in. That person's brilliant. I'm going to work with them. So I talked about some of the great staff I've worked with over the years. For me, that was stepping your toe in to a little bit of academia, which wasn't anywhere I necessarily wanted to go anywhere near, and then going, oh, actually, that's quite interesting. And then the next thing comes, and I worked with Dr. McCarthy, Kate, who was brilliant with me early doors, and sort of said, no, that level of encouragement, and then you went on, and then before you know it, you start to build a delivery career and stepping into those areas you don't know, and that acknowledgement that research delivery is a speciality in its own right, and that driving forward there was much more clear, and we all know on this call, for those that have done it, a clearer cut pathway than there ever has been, but it still needs negotiating, and you can still influence it yourself. And I think that's key, sort of having that confidence to go and have conversations at different levels. I don't know what it's been like for yourself, Alison, since you've obviously had a much more academic career than me and sort of navigated that way.
Yeah, I mean, it was always the people that sort of took me under their wing and sort of opened up those opportunities, said, have you thought of this? Have you thought of that? That have sort of enabled me to realise what was available. But I was there right at the very start with the very first offer of an NIHR studentship in 2009. So I was just right place, right time, very lucky to get that one. I have come from, I have had those opportunities and I've wanted to give it back because I've realised how lucky I've been. So I'm now in a role where I'm doing that. There aren't a lot of trusts in the country that have my particular role in the NHS, that is setting up a team to deliver that sort of support and signposting and talent spotting that my role encompasses. However, the intention is there to do that, and there's lots of work going on at national level to have those sorts of academic pathways made more visible, so that people can approach them. But I would just say, go straight to the top. If you read something about something that you are interested in, go straight to the top. I had one of Saul's colleagues actually on the PCAF who went straight to the Dean of Research at Cambridge University because he was the most prolific author in a particular field she was looking at, and she asked would he be her pre-doctoral mentor, and he said yes. So, it's just, you just have to ask. Everybody wants to give back. Everybody wants to help and succession plan and bring forth the new generation of researchers. So just ask and don't be afraid of doing it. We just all want to help.
Yeah, it's a very friendly community, isn't it, once you get up and running? So yeah, go ahead.
Yeah, just add one thing. I think it's important to recognise that there are challenges and people do need to have a little bit of resilience, and things are competitive at times and there are bottlenecks because lots of people want. However, having said that, I think there are lots of different opportunities, particularly if you want to do PhDs. And I know the NIHR one is the one that everyone knows about, but I know people who've been on a PhD from Wellcome Trust, people who've had funding from industry, people who've done studentships. So I think if people have got the determination to do it, there's lots of opportunities available. But yeah, you do get rejection, don't you? You do apply for things. It's time consuming to put together an application, and you have to accept that at times you're not going to get it, but there will be other opportunities. I think with resilience, you will get to where you want to go. And I think that's what I've seen every one of my kind of cohort has happened to them. So, have hope and keep applying.
But yeah, great point around the resilience that I needed. Like I said, it is very supportive, but it is competitive. And we've got 1 minute, so I'll round up there. So hopefully you can see we've got a direction of travel nationally, lots of different ways to do it. You'll be curious, ask for support, be bold, be confident. If you don't know where to go, keep asking questions. There's always someone that will know somewhere else. You may, as I said, you may get a knock back, but another door may open up for you. So hopefully that's at the very least been interesting for you today. Thank you for joining us and listening. If you do have any questions, please pop them in the chat or get in touch with the email you can see there, and I will forward them on to the right people. And I say I'll pop mine in the chat should anyone want to message me directly. Any final words? Anyone else? We've got 30 seconds left, and I think we've kept to time. Lovely. Well, thank you all very much. Enjoy the rest of your day, and hopefully you've got some sunshine nearby, and hopefully our paths will cross in the future.